This conference will now be recorded.
Um, all right. My name is Frank Rivera. I'm one of the moderators, but I'm actually the founder of this group here, Sarcoidosis National Online Group. Like I was talking with Crystal, some days we get hardly any people because I wasn't promoted as much. I just saw the promotions up today. They just put them out, so kind of late. But you know, once again, everybody that's a moderator does also have sarcoidosis, so we never know how we're gonna feel. So that's why we made this, is because we know how when we feel sick, how much we want. Sometimes we want to talk to people and find different answers from different people. Just so you guys know, none of the answers here are doctor answers. We cannot speak for a doctor. It's just our experience. And one other thing I do like to let everybody know is that everybody reacts differently to sarcoidosis and to sarcoidosis medications. So we can tell you to try this or try that. It doesn't always mean that it's going to work for you. But we can give you, like I said, alternatives, and you can discuss it with your doctors. Hey, Jim, how you doing?
Good, thank you. I just got off the, well, I left Rick over at the advanced prostate cancer meeting. That's going for another hour. Yes. I dropped off. Hi, everybody.
Yeah. Crystal, since you're new, I'm going to put you on the spot. Just really quickly, you can tell us who you are, where you're from, where you have your sarcoidosis, and like when you were diagnosed. Just a couple of facts about that.
Well, I live in Richmond, Virginia right now. I was diagnosed when I was 35, except the thing is that I was complaining about things for years before that, and I'm not quite sure how somebody did not check the gigantic lumps coming out right now. So first I was diagnosed with pulmonary sarcoidosis. Then like 8 months later, I had cardiac sarcoidosis. 2 weeks later, I got my pacemaker and defibrillator. Then my skin and my eyes were about 8 months ago. And I just had the MRI to check my brain a couple of weeks ago. And then the neurologist called and said something about nodules and it's probably sarcoidosis. But he kind of skimmed past that and went to another problem that popped up on my MRI. So I'm currently waiting for one of the people in my sarcoid team to get back to me, because I also have a crazy amount of cardiac issues, and I have 3 different types of arthritis because of this, and it is extremely tough. And this is my first time to any form of a support group, because I just everything. I'm getting like a little bit emotional actually seeing faces of people that feel the way that I do, because it's absolutely terrible. And I currently take methotrexate and azathioprine for it. Before I was on Remicade and Xeljanz, I think, but the side effects were terrible. So that's my story currently.
Well, welcome to the group. Unfortunately, you had to get sarcoidosis to come here, but nice to meet you. If you have any specific questions, just let us know. We've been through a lot of different. I'm going to actually have everybody, since it's a small crowd here, everybody can go through. Giselle, would you just talk about where you're from? I know where you're from, but everybody else. And where you have sarcoidosis and how long you've had
it for. Yes, I'm in Sunnyvale, California, which is just below San Francisco. I've had sarcoidosis since 1985, and it was in my lymph nodes and in my lungs, and it eventually went away. I didn't have to go on medication. But when I went into liver failure in 2012, they found sarcoidosis in my liver. And that's where it is now that they know of. But I also have autoimmune hepatitis. And just in December, long story short, I now can no longer take Imuron because it's affecting my bone marrow. So I'm on no medication whatsoever now. My liver is stable, but my bone marrow is still damaged. We're going to wait till July to see what happens. So the liver, so it's in the liver, but we don't really know what it's doing in there. And I can't really take any medication. So I'm kind of in limbo. But I feel okay. I don't have any problems. The Imuron did cause me to get cancer. I did have breast cancer that I had to deal with, and it was tough. But I guess my autoimmune hepatitis is more of a concern than my sarcoidosis because I can't do anything about the sarcoidosis. So, but they're all in there, and I'm going to be 75 pretty soon, and but I'm still here since 1985. So it's I've had it for quite a long time. So, but I'm good. I just need a little more support because of my autoimmune hepatitis in conjunction with the sarcoidosis in the liver, and I also have steatohepatitis in there. It's called NASH. It's a non-alcoholic steatohepatitis. It's also in the liver, and so it was just overwhelming to deal with all this. And so I thought I'd reach out for a support group to know I'm not alone. There's other people going through what I'm going through. So, and that's about it. I'm good.
Well, thank you, Giselle. Kevin, I'm going to have you start now.
Okay, hi, my name's Kevin. I'm a bit of a veteran of this group. I've been around for about the last year or so when I first found it. I started off with sarcoidosis, got diagnosed 11 years ago, confirmed diagnosis in my lungs and lymph nodes. But for various reasons, I am convinced, and my doctors are convinced, that I've had it for much longer than that. In January of 2020, I was in a motor vehicle accident, and coming out of that, I went to the emergency department, and my heart was in atrial fibrillation, and we went through a progression where it ended up with a PET scan confirming cardiac sarcoidosis, and they immediately put me on prednisone. Took us a while to find a steroid-sparing agent, and by July was making progress, but still had a lot of inflammation in the heart. And then by December, towards the end of last year, I ended up with a clear heart. So it's left my heart. I have an ICD. They're monitoring that to keep a track on, figuring that I'll start having arrhythmias if the inflammation comes back. So that's where we are now. I'm tapering my prednisone. I'm down to 3 milligrams per week, and I'm dropping, or 3 milligrams a day, and I'm dropping 1 milligram every month. So by August, I should be off prednisone, provided everything moves forward. And they'll do another PET scan to check, make sure it hasn't come back, and then we go from there. So I'm in a quiescent mode right now, but it was a rough 2020.
And like I was saying earlier, Kevin is going to be one of our new moderators as well, since he's been here for a while. And I kind of wanted to just say really quick is that I picked like 9 moderators. They all have sarcoidosis, but unfortunately, it's been a bad year for everyone. So there haven't been as many moderators on as we need. So I'm trying to still recruit some more moderators just to get us keep us going until so everybody can come back. We all know how we feel. We all know how it feels to be in bad shape or stuff like that. So we try to work with each other as much as possible. Jim, I'm gonna let you speak for.
Okay, Frank, thanks. Congratulations, Kevin.
Thank you.
Okay, that's wonderful. Glad to have you on board. My story is one that I was diagnosed with advanced prostate cancer back in 2017, and we went through a major attack of that over a couple of years, where I had radiation, hormonal therapy, and chemo. And obviously my Gleason score, which is as far as your prostate, came up to be a 10, which is the worst score you could have, which meant the cancer was pretty aggressive. So after the 2 years of treatment, and during the 2 years of treatment, other than the reaction to the chemo and the radiation and the hormones, I really didn't do too bad. I was kind of had a pretty good run there. And then I went on I guess what we call a drug holiday, where I pretty much went off of all the meds and the treatments, and we're watching my PSA and my testosterone levels, and everything was going well until about October of last year, and then that's when pretty much all my levels started accelerating, and had a PET scan, and the PET scan indicated that I had a lot of hot spots on the lung. And the normal, not the normal, but one of the progressions with the prostate cancer is it moves on to your bones and into your lymph nodes. So the thought from my oncologist was, well, it looks like the cancer's on the move, the prostate cancer. So let's see what we can do here. And then there was a discussion about, well, you got all these hot spots. We got to learn more, so we need some biopsies. So I had an EBUS where they go down the throat and take some cultures, and then I forget what it was called, where they cut my throat and went in and got some tissue, and then the pulmonologist who was involved with that, he said to me, "Oh, I have good news for you. It's not prostate cancer, but I believe you have sarcoidosis." So that's how I'm relatively new addressing this, and my primary issue is the advanced prostate cancer. But so then it's funny because I was talking with Rick Davis, and Rick says, "Oh, we have a group for that." So here I am. So I'm basically ANCAMing, double teaming in ANCAM. I have the advanced cancer group that I'm on, and now I guess I'm a junior member of the Sarcoidosis group.
All right. Well, thank you and welcome. All right. I'll tell you a little bit about myself. I'm going to try to keep it as short as possible. I was misdiagnosed in 2004. I was a runner, and I went out to go for a run. I was running 5 to 10 miles a day. I went out a quarter of a mile and had to call my girlfriend at the time. I can't go any further. Can you pick me up? I was just totally having trouble breathing. I went to this was in Florida. I went to the hospital. They saw, the masses like everybody else. They did a biopsy like everybody else, but instead of saying, you don't have cancer, you have sarcoidosis, I got, you have cancer. You have lung cancer. So I went through 4 years of chemo and radiation, for which I found out in 2011 that I never had cancer. So the chemo and radiation, the chemo helped because it helped the masses from not growing, but the radiation killed my body so bad that I was down to 98 pounds. And then unfortunately, by the time I got diagnosed, I already had it at 75% of my body. So fast forward from 2011 and 9 surgeries later, I have it in pretty much every major organ in my body right now. I don't, people are like, oh man, why do you smile? well, what do I have? What else can you do? I mean, you have two. I always say you have two choices. You can roll up into a ball and give up, or you can fight. I chose to fight. In that time, I started my own nonprofit organization called Sarcoidosis of Long Island. And then just this year, we opened up a national organization called Stronger Than Sarcoidosis. The people on the board of Stronger Than Sarcoidosis are all patients. So it's a patient-based, and it's for patients. You know, because a lot of times, like if you call I mean, nothing against the other organizations. They all are great. We work side by side with FSR, with Bernie Mac, but most of the people that work there don't actually have sarcoidosis. So by the time, what they do is like you call and ask for help, they'll call me or they'll call somebody like me. And then, so we kind of are trying to cut out the middleman, because by the time you get called back from one of us, it could be way late, a month later, and that's too late for a sarcoidosis patient wants to know what's going on now. So we're trying to break the gap, and we're still working with FSR, and we're helping each other out. But like I said, in the meantime, I've been lucky enough. I wrote 2 books. One came out, actually both of them came out in 2020. One's totally about sarcoidosis and my journey in sarcoidosis. The other one is really my whole journey of my life and everything else. But I also have been on TV, done podcasts, and done things here and there, and start a whole bunch of these forums up. We actually, in August, we're going to have another forum. It's basically going to be like the support group, but we're going to have doctors, government officials, people talking about, this one is about diversity, and it's economic and social diversity when it comes to healthcare, insurance, clinical trials. We're hitting all of that and trying, just so people understand the process, because everybody's always saying, we want a cure. Well, you got to be part of the process to be the cure. People have to be part of the process, otherwise we'll never find a cure. So we really want to teach people what the process is so they understand. And we can also, when we're talking about diversity, it means that how we can get everybody included. Because a lot of like the clinical trials, they'll have clinical trials, but like I live in New York. I don't even drive anymore because I also have Parkinson's, I have Sjogren's, IBS, diabetes, MS, and not finished on my throat yet, but having some sort of esophageal problem. So I can't drive to these clinical trials. What are they going to do to make it easier for us to get to these trials and stuff like that? So that's something that we're working on as a group, and we have a lot of good speakers at most of these forums. We already did a social justice one, and we also did a mental health. I'm very big on mental health. I know a lot of men, especially, think it's unique to go to speak to a counselor, but no, a counselor saved my life, I can tell you there's a lot more of us that it has helped us more than it hurts. And so we try to get rid of that stigma of, you're weak if you speak to a counselor. This disease is tough. We all know it's tough. I mean, when you really get hit with it, I mean, it's just really tough to handle. It's like there is no cause, there is no cure. So people are like, what are we doing? What are we going to do? Some of the medications work, some of them don't. And, so it's a very rough thing to go, especially if you're going at it alone. So we always, try to reach out. We try to even help people try to find mental health counselors if they don't have one already. So, yeah, that's basically where I'm at. Like I said, we have 10 other moderators, 9 other moderators, and they all have as much experience or more experience than I do personally. I try to pick, and they have all different experiences. Some people have it in their heart. Some people have it like me, all over. Some people just have it in their lungs. but I try to make it that it's a wide variety. So when anybody asks a question, they would know, or they can find somebody, or like how Giselle, you were asking about the support group. At least somebody will know how to get you to that spot. So, other than that, I'm gonna ask Dan to give a hi, tell us, who you are, where, tell us your sarcoidosis story, all that good stuff, Dan.
Hello, my name's Dan. I'm from the St. Louis area. I found Frank online through someone else from St. Louis who was running a group on Facebook, and I guess no longer was running it anymore. So she referred me to Frank, and that's how I got connected to this support group. But originally, I went in with pain in my what I thought was like a kidney stone, or something like some sort of kidney infection. Long story short, that's not what it was. They did scans and immediately told me it looked like I had some sort of lymphoma. And so that scared the hell out of me, right? So that's the first thing I heard from not a doctor, but like a nurse practitioner at urgent care. And he said it looks like it has metastasized or whatever, right? So I'm freaking out. My life changed in, a matter of hours. So long story short, we go and I have my biopsy of my spleen. And so that's kind of how they started to rule it out after talking to about 3 or 4 different experts. It's been crazy. Since then, I've kind of done Weight Watchers and gotten kind of what I could control under control on my own. I've recently gained about 10 pounds, so I need to lose that again. But overall, I'm down about, over the past year and a half, maybe about 80, 85 pounds. So I got rid of my diabetes too that I was diagnosed with, Frank, so that's good. So yeah, now I'm just dealing with weird, I would assume it's probably flare-ups. I'm not sure. I always feel like I have a sore throat and a cold. Like, I know some people might say it's sinuses. I've never had sinuses this bad in my life that lasted this long. And it's been going on, mostly on for about the past year. So that's pretty much where I'm at right now. I'm kind of not really talking to my doctors as often as I should be, and that's kind of why I'm joining back tonight. I kind of just want to get back on top of my health again and make sure nothing's being overlooked. So, thank you.
Welcome back, Dan. Good to see you. I also took a big leave for a couple of months because I was sick, and the way I look at it, people have to deal with it in their own way. All we can do is suggest, and we will be there to help them when they need it. But there's sometimes where you just, some people just want to be by themselves and need to be by themselves at times. I left for a couple of months because early of last March, I did have COVID, and I fought COVID, and it beat me up, and I still have long-lasting effects from COVID, unfortunately, because I'm sure most of you know a PFT is pulmonary function test. My pulmonary function tests were running around 95%, which is great. I got COVID. My oxygen level dropped, like I said, to the 60s. My pulmonary, I couldn't even finish the first part of the pulmonary function. So that's how bad it was. And then pretty much I quarantined myself in a room. I was going to go to the hospital, but my doctor told me no, because it was right in the middle of when New York got really hit. And they were like, if you go, you're going to die. So I was like, okay, I'll stay home then. But yeah, so that's one of the reasons why I left. And I've been fighting this COVID problems. It affected my eyes. It affected giving me I've had migraines before, but now the migraines are so intense. I've gotten actually getting Botox injections because of these migraines. every 3 months, and it's like 21 shots in your head and your neck. Not fun, but they work. So yeah, so it's been a kind of a crazy year for a lot of the people that are moderators, a lot of people that you'll see if you do get in touch with one of the national organizations, FSR. All our moderators are part of FSR, the ambassador program or advocate program. We've been finding out so many people are having so many different problems, whether it be they had COVID or their mental health, being stuck in the house, 24/7. That's tough. But some others are like, you know what? I'm in the house most of the time anyway, so it really didn't bother me. So, like I said, everybody's different. So you really have to, you kind of cater to what is best for you. I never say, oh, I got it in more parts of my body than anybody else, because it doesn't matter what part of your body, it hurts. It can hurt. If you get a flare up, it hurts. But does anybody have any questions, like whether it be medication related or even mental health, or any kind of question sarcoidosis related that they wanted to ask?
I do.
Yeah, sure.
I apologize, but as I said, it's my first time in any form of a support group. I was told multiple times by doctors in my sarcoid team that like depression can be a part of having sarcoidosis, and I swear to you that I never believed that woman, because I am generally an extremely happy person, much like you, Frank, because I always say we have two options: you can laugh or you can cry, and laughing's way more fun. But I feel like every time that I'm tacking on another organ, I'm beginning to feel more defeated, and that's like not even me. So is that normal?
Yeah, there's a couple of things about that's normal. It's the side effects for medicine. If you look at a lot of our side effects for a lot of our medicines that we use, depression is part of that, especially prednisone. That's very big with prednisone. But there are others, like if you're using methotrexate, that's the same thing, because that's actually a chemotherapy drug. So it could be the medications. It could be just like you're saying. You go, like I went through this period of, I went to the doctor, and every time I went, it was something new, and I was like, all right, I'm just gonna stop coming to you. And so yeah, that alone can get to you. That's why I always say, it's not a bad thing to talk to a counselor. There are counselors that do a special for patients. They have counselors because they understand the side effects of the medicines and stuff like that. Or if they don't know right away, a lot of them will go look it up. So there are special counselors for that. If you do need any help with that part of it, let me know. I have a whole list from all different areas of.
I would love.
Is in Australia.
Mm-hmm.
So yeah, so I have a lot of that, so I can help you with that. At least go on the look, and it's somebody to talk to, and just like I've been since 2011. I've been with the same counselor, and I've told. I know Dan and Kevin probably have heard this. In 2015, I thought about committing suicide. I already had it all planned out and everything. I called my counselor, and I really called her to say goodbye. And she talked me out of doing it, and I ended up signing myself into a 72-hour watch at a hospital, which saved my life. I can't see myself ever thinking that way again. I don't know why I did, but it was mainly because I was in that spot where you were talking about, where you go and they tell you, oh, different spot. Oh, it's this spot. Well, I got to the point where they tell me it's a different spot, but you can't take any of these medicines anymore. So I'm like, so what are we doing here? Why even tell me at this point? So yeah, so I did, I know how it feels. And like I said, it doesn't make you a lesser person to go speaking to a counselor. Dan, you and I have talked about this many times. And I know Kevin and I have talked, and the group has talked about it. It is something that we all are encouraged, because you can't do this all by yourself. Because first of all, the drugs are going to be messing with your brain as it, and then you also have the pain that's messing with your brain. Now you're asking your brain to cope with the depression, the pain, the medicines. Your brain can't do it. I mean, I don't know too many people that strong that can do that. So give yourself a chance. Give yourself a fighting chance. That's why I always talk about it. And my counselor doesn't put me on any drugs or anything like that. She's not even allowed to. But it's some place where I can unload. And I see her once a week, and I just unload for an hour, and it makes me feel a lot better. But yeah, so Crystal, let me know, and I'll get in touch with you. And if you want, I put my email in that chat on the side. Take my email, just write me an email, give me your area, so I can help you with that. And we can. And if you need somebody to talk to, like I said, I've been through it. I understand it. It just, it is hard. And especially people who get new. I mean, all of us remember when we first got this thing, it was like, what? Like, it was weird for me because my brother-in-law actually has it. And he's been in remission for like 30 years now, almost. He got one flare up in like 30 years. So when I heard sarcoidosis, I'm thinking, all right, this is going to be easy. It's a prednisone, I'm good to go. But unfortunately, it was so late when I got diagnosed. Like I said, 75% of my body was too late for me not to be in chronic condition. So it affects people differently. We always call it the snowflake disease because no two snowflakes are the same. No two sarcoidosis patients are the same. We can, like I said earlier, we can give you information, we can give you our opinions, but you really still have to talk to the doctors with everything. Don't just say, well, Frank said this. Definitely like, let's see. And unfortunately, a lot of the bigger name sarcoidosis doctors do know my name because I do bother them. Because anytime I find information, I always call the top guys, ask them if it really works. I mean, I've heard some doozies. Somebody told me that they went into remission because they were eating papaya. I was like, that's great. We're all gonna eat papaya and be fine. Now, I mean, first of all, people don't realize, like, this papaya, if you have a latex allergy, you can't eat papaya.
What?
Kathleen, she's the one who told me about it.
Yeah.
She's like, I can't even eat it. I'm like, yeah, I don't think it works. So yeah, I'll go there with some crazy questions, and I'll go there with, this medicine really is doing well. What do you think? And he's like, well, you have these other diseases. You can't take this medicine. It's always to have some doctor to make sure that, what people are saying is the right thing. Any other questions or ideas or anything?
I have a question. This is for everyone. So at their next meeting on June 20th, I've arranged for my sarcoidosis doctor, who's the head of Jefferson University Hospital in Philadelphia's sarcoidosis program, to come on and speak to this group. And so far, we have understanding. So I'm looking for topics that we can give him to speak about. So during the last couple of meetings, we've gotten different ideas. And here's what we have so far. And if there's anything else you'd like to see him cover, please let me know. And Frank and I will coordinate to get that presentation to help everybody as much as we can. So the first topic is hereditary component. So Frank, your brother had it. It does follow families, but is that the only thing that's important? Others wanted to know the sequence of medications, like when to stop prednisone and start methotrexate, when to start Cellcept, Remicade. There's a whole bunch of them. A discussion of chronic versus acute. So in my understanding, chronic is what most of us have. It sits there and goes on in the background and flares and comes down and you go into remission and it comes back. And as opposed to acute, which is you get it, you have some reaction, your lungs hurt, you get your prednisone or not, and it goes away and you never hear from it again. So you're exposed to something, your body reacted, but it's not part of your normal environment. So it comes and goes and you're done. Also wanted to have him give some opinion on diet and fasting. So these are areas that I've been working on, and I've got my opinions. I'd love to hear a doctor's point of view. Today we were talking about vaccine effectiveness when you're on immunosuppressants. How can we determine if we need a booster shot? Something I'd be interested in. So they've taken a new approach for these, for the Pfizer and Moderna vaccines using mRNA to deliver sequencing information. And there's a lot of additional uses for mRNA, like fighting cancer and fighting various things. Is anyone looking at sarcoidosis as a possible target for mRNA technology? And then the last one that we had was what we call expososome. So it's kind of like the sum history of everything you've been exposed to in your life, and whether that's something to consider with sarcoidosis. So different people have different things they've been exposed to: toxic mold, mercury, influenzas, etc. Is there any understanding of like what we can avoid to prevent a flare-up or something like that? Is kind of where I was going to take it. So does anyone have anything else we'd like to possibly hear from in terms of a topic from a world-renowned expert in sarcoidosis?
I I do have something, but I'm not even sure if this is even like a question or something. I actually was diagnosed with sarcoidosis back in 2010. It just kind of progressed and got out of control from there. But like, I have repeatedly asked my doctors if there's any way that I could help myself through diet, and I did specifically ask about fasting or something, but I have so many other diseases that they kind of get lost and have like tunnel vision on other things and do not answer basic questions that I have, or like, is there something I can do to help my fatigue? Because I swear to you, on a daily basis, I am so exhausted that even blinking my eyes feels like it's all of my energy.
Yeah,
So
the fatigue can be horrible. Yes.
Oh, it's so ridiculous. Like,
unfortunately, that's one area that we all get.
Yeah, fatigue seems to be a common denominator for a lot of us.
Yeah.
So Crystal, I'll send you my email address. Feel free to reach out. I personally believe the dietary changes I've made are why I am where I am today. I mean, I
could say the same, actually.
Yeah. So I'd be happy to share everything I've learned and get you on the right path.
I was
appreciate that.
Like I said earlier, I was diagnosed with diabetes. My diabetes was prednisone induced. Prednisone, too much prednisone raises your blood sugar, and mine raised just a little too high. When they found out it was at 610, that's ridiculous. But when I actually, I got to the hospital and I took it, it was 890. They were asking me, "How are you speaking? How are you not in a coma?" I'm like, "I don't know. I never had diabetes before. I don't know what I'm supposed to be doing." Yeah. So, but within a month and a half, I'm actually off of all medicines for diabetes. It's been running 90s, even high 80s.
Yeah, there's a lot of presentations on TED Talks.
Yes.
Which is a fantastic way of getting subject matter experts talking on specific topics. And the two that come to mind for me were, one was a woman got up and talked about reversing type 2 diabetes. And the first thing you have to do is ignore and do the opposite of everything your doctor tells you. And she went on to
said that to me.
Yeah, to show the results that she got, and it's not rocket science. So that was one. The other is Dr. Wahl, W-A-H-L, and she has a great talk on the Wahl protocol. And here's a woman who had advanced aggressive MS and followed the typical protocols and was in a wheelchair and not able to practice medicine anymore. And then did the research, changed her diet, all organic, whole foods, vegetables, a little bit of protein, and she's walking and practicing now. So she reversed the impossible with MS, and it was all diet. I'd be happy to share whatever I found and my experience with that.
Yeah, we can. And I'm gonna try to also get one of the advocates. She's a doctor, Dr. Mary McGonigal. Yeah, she also speaks highly of about your diet and how and she personally didn't have sarcoidosis, but her husband did.
Yep.
But she's been, she's really involved right now. She's all over. So I'm gonna see if I can get her to speak about it too.
That'd be great. She was the primary impetus for me. So I told my doctor that I was looking at that, and he goes, "You're on the right path," and introduced me to Mary McGonigal, whose husband he treated. Unfortunately, it was too little, too late.
Yeah, but, he got diagnosed late. Really late.
Yeah, and so she was my nutritionist on my team, and gave me a lot of ideas and walked me through an elimination diet. And,
I could tell you right now, one of the things, like, because of the diabetes for me, I went on a strict diet of, of course, the no sugar. And, it's really not a no sugar. It's really a low carbohydrate diet. And I do for every meal 60 carbohydrates. And it doesn't sound like much, but most of the time I can't even fill that on my plate. But the energy I have now compared to what I had in the beginning of the year is night and day. It really is. And I mean, some of you guys who've seen me since the beginning know, I mean, I was pretty much tired.
And would you also say, Frank, that the energy is more consistent throughout the day and you're not cycling up and down with the sugar highs? Yep.
Yeah, so I'm really starting to get into that whole diet. First, I'm like, I don't want to give up my ice cream.
Kevin, I'd be interested in receiving that information also, because I've made some changes in my diet with my autoimmune hepatitis, and this would probably help my sarcoidosis also. I'd appreciate that.
I will send my email out on the chat to everyone. Okay. And anyone who wants to hit me up, I'd be happy to share.
My issue with the diet is that I have a mechanical aortic valve, and so I've been on blood thinners since 2006. So I have like issues with like solely plant-based diets because I'm not allowed to have a lot of food. Like I can't have any vitamin K whatsoever because I've been taking Coumadin ever in a day because I've had 3 heart surgeries.
And my mother was on one of those kind of diets because since she was like 8, she had heart problems. Her diet, as she got older, she finally really agreed with the diets and started doing it, and she really felt so much better. Even there are specific diets for like for thinning of when you already have your blood being thinned out. So yeah, we can talk with Mary. Like I said, she is a doctor, so I'm gonna really talk to her and see if she'll come in. I don't see why. I just have to figure out what we'll work on a time and date together. I'll really get in touch with her. I know we got a whole bunch of new people in. Started out with 4. James, how are you doing today?
I'm doing great, thank you. Good to see you, Frank.
Good to see you too. I know I've been MIA for a while. Sorry.
as have I. I come once a month now, and as you know, I'm sarcoid free right now, and enjoying life and getting back to normal on a lot of different things. So, but I wanted to come show my support for the group, which was invaluable to me the last 2 years. So,
I do appreciate you coming. I see we have a caller. It doesn't see the one bad thing. It doesn't tell us your name, caller. Hello. No, they're not talking. Maybe they're just listening in. Wendy, are you talking today?
Hello, everybody.
Hi, Wendy. How are you doing?
I hope everybody is trying to find a cure for this disease.
Hey, you know, we're still trying. And Trina, hi, Trina. Trina's one of our moderators. You want to introduce yourself a little bit, Trina? Since we have some new people here.
Hello, everyone. I'm Trina Massey Davis. I'm out here in Atlanta, Georgia. Actually, DeKalb County, just the metropolitan. Been misdiagnosed for now going on 30 years. And just here to assist in any way I can, and welcome. You're in the right place.
Yeah, Trina and I have known each other for years, right? Right, Trina? We've been going probably about
what 6, 7 years?
Yeah, at least. She actually organized the first time we really met with when you organized that the briefing, congressional briefing. She set up a congressional briefing that we were able to talk in front of Congress aides and senators aides. That was really nice and great. It was a great briefing.
That was actually that was our first go round. Remember? I think that's what opened everything up. You know, with our participation and the hard work, the diligence that we had and we still have. That opened up everything that's going on today. So I commend you, Frank. You're a warrior for real. We all are, but I love you, brother.
Mm-hmm. Yeah, I mean, and like I said, we've been both through a lot. We know that's why Trina has been a moderator here, because, like I said, she has different, you know, some things have been different with her than there is with me, and it's kind of, you know, a lot of the people that we pick we've known each other for years, and we always bounce things off of each other, even outside of this. Like I said, we're brothers and sisters and all that other family. We always call it the Sarcoidosis family. So.
Nothing but Sarcoidosis love.
So Eric, how you doing?
Good. Hello. This is my first time.
Oh, well, welcome aboard. Can you just tell us a little bit about yourself, where you're from, when did you get diagnosed, and where do you have some?
Yes. So I'm from a small town in southwest Washington State, about 30 miles north of Portland, Oregon. Name of the town is Woodland. And I've got 3 kids. And so I was diagnosed about 1.5 years ago. And I'm still struggling to find decent treatment in the area, decent medical help. So in a couple weeks, I have an appointment with a specialist in Portland. Well, it's a pulmonologist that focuses on sarcoidosis. So I'm hoping he'll be able to give a little more insight. So far, I've only treatment has been prednisone, which I took last year for a few months. It did not work well for me with side effects. So it did make some progress, and I ended up going off it last year. And it looks like based on recent CT scans, I'm going back on sarcoidosis, or not back on prednisone. and then going to see a specialist, the doctor that focuses on sarcoidosis here in a couple weeks, and see if he can offer any suggestions. So mainly what I was started looking for in the online support and maybe here was that the help with the fatigue challenges that I hear other people talk about.
Okay. Yeah. So first off, if you do, if hopefully that doctor works, but if you do need others, please let me know. Or I put my name in the chat. I put my email address in there. It's fjr311@gmail.com. I have a list of doctors. Like I said earlier, I have doctors and I have counselors as far as Australia. So my list goes pretty far and wide. Actually, here's a really quick story. The very first time I went to go see my senator, Schumer is my senator. His health aide actually called me a week before I was going to meet them for the very first time. Her mother lives in the state of Washington. That week she found out she had sarcoidosis. I gave her a doctor over there, and now she's in remission. So if you do need any doctors over there, please let me know. Eric,
Okay.
all here to help you out, and thank you for coming.
Excuse me, Frank, can you repeat what you just said about Mr. Schumer?
Oh, yeah, Senator Schumer's health aide. She's no longer there, but Senator Schumer has been a bit helped because of this. 2 weeks before the very first time I was supposed to meet him, I get a call from the health aide. She saying, "I heard you're coming to talk about sarcoidosis." I said, "Yeah." And she's like, "Well, my mother just got diagnosed, and there was like 5 different things going wrong, and she didn't understand what to do, and the doctors didn't know." So about 15 minutes later, I told her, "Give me 15 minutes, and I'll call you back." And I found the doctor over there, and she's been in remission for 4.5 years now. So yeah,
Thank you, FR.
It's just a matter of when you were diagnosed. Like I said earlier, it's a matter when you were diagnosed. It's a matter of how far along it is, and like Eric, like we were talking about earlier, is our diet is one thing you really should look into. Try to stay away from, try to stay away from the sugary items because that causes inflammation. That's really, really known. But there are some diets that will help for fatigue. And like I said, I had diabetes. I got diagnosed with diabetes in January. And a month and a half later, I don't have diabetes anymore. I changed my diet. I'm not taking insulin. I'm not taking any pill for diabetes anymore. And a lot of it had to go towards the diet part of it. When they told me the diet, I laughed like, no way. It's really funny. It's all it was like 60 carbohydrate diet. For every meal, you're allowed 60 carbohydrates and nothing more. And they really try to say nothing less because if you eat less, your sugar will drop. But nothing, at least nothing more. And it helped with my energy. And then I was diagnosed in January 4th, and February 23rd, I went to the doctor, and for 2 weeks straight, my blood sugar was either in the 80s or 90s. When I went to the hospital in January, it was 890. It was 890. Yeah, so a massive drop. And like I was saying earlier, my energy is so much better now. I really believe diet helps so much. And it helps with the fatigue. Because some of these, like that, what I found out with the sugars is that the sugar is really like a fake. It's really faking your body to have energy. But then if you don't have the sugar, it craves that sugar. And that's why you have to kind of break off of it slowly, because it's really fake energy. Sugar is fake energy. So that's one of the main things that they did teach me. And Kevin, so next meeting, the 20th, we're having we're going to actually have a sarcoidosis doctor here. He's Kevin's doctor, and we're going to be able to ask questions, and you could talk about diet. He even has that in one of the things we're going to talk about. What's that?
I'm sorry. Frank, the 20th of June?
Yeah, I think that's it.
That's a Sunday, I believe.
Nope. Oh, wait. Kevin, what day is it? How are we doing it then?
The
18th?
20th is Thursday.
17th.
No, I'm sorry. My bad. I'm in the wrong month.
Yeah, 17th.
Actually, the 20th is Father's Day. It's a Sunday. You're correct.
Yeah.
But the 17th is the next
meeting.
17th is the next meeting.
Yeah.
What was? I'm sorry. What's the revised date?
It's June 17th is when we're gonna have the next meeting.
June 17th. Okay.
Yeah. And that's when the doctor will be here, and we'll.
Okay. I just want to make sure I block that out. Thank you, gentlemen.
But let's try and get a good number of people here.
Yes.
So we
get
more questions, more interaction.
It definitely.
What about the can you tell Eric about the Life and Breath has some videos on their
Oh yeah. If you're on Facebook or and on YouTube, they have, it's called Life and Breath Foundation. They have a lot of different videos about sarcoidosis and diet. Also, they talk to a lot of doctors. I think they even have counselors on there. Yeah, they do at least 1 or 2 a month, and they're very informative.
Life and Breath is on YouTube.
Yeah, I tell you, I put the thing what the name of the organization is.
Oh, okay, I see it now. Thank you, Frank.
Yeah, it's on YouTube and it's also on Facebook. So you can get to them in either way. And like I said, my email's in there also. So if you have any questions about any of this, I can send you the information. There's a lot of different organizations. Even FSR is doing a lot of more forums and teaching, and it's really very informative lately. And I think now that we are getting out of the COVID mode and getting back into more of a regular, there'll be a lot more information for you guys. And if I get it, I will definitely pass it along. For Eric, are you on Facebook?
Yes.
Okay.
That's how I found the group. Yeah.
Okay. If you're on this, are you on the Sarcoidosis National one, that group?
Yes.
All right. Hit me up on there. My name is Frank Rivera. And this way I could just send stuff to you that way, easy too. Either way. But I'm always putting up new information on my own page as well as my organization, Stronger Than Sarcoidosis page. So we have a lot of information. There's a lot of good information coming around now. It took, like Trina, we talk about it all the time. It took 8 years, 9 years for it to, when I first found out I had sarcoidosis, the national organization at the time, Foundation for Sarcoidosis Research, had 4 employees. And trying to get in touch with the 4 employees was so much fun. Now they're up to 8 to 10, actually 10, I think now. I mean, I just saw 2 new names on it yesterday. I'm like, wow. So yeah, so they're adding names.
But Mindy told us now she's in Scotland. She's out of Scotland.
Well, right now she is. Until the ban is off. That's the problem. The ban. Europe is still banned from coming here. It's not banned anymore. I think you have to wait like 14 days or something like that, or something crazy like that. But so a lot of them are working at home, but they're actually, what I see them doing now compared to even last year is totally different. I mean, there's so much information is being put out of there, which is great. All right, Dan.
Eric, I learned the most from Frank through everything that I've gone through. You learn a lot from Frank.
The way I look at it is if I can help one person a day, I'm a very happy camper. That's the way I look at it at this point.
Good,
And
Frank.
if I have the one thing about me is if I have the information, I will let you know. If I don't have the information, I will also let you know I don't have it, but I will find out for you. And that's something that I vote. Trina knows integrity is my biggest, the biggest thing I talk about. I always say, when you pass, you're not going to pass with your money. You're not going to pass with everything that you bought. People are going to know you for who you are. And that's the way I am. If I say I'm going to get you something, I'm going to make sure I get you that, the information. That's one thing you can. But yeah, and Trina, Trina's been since they started the Advocate Ambassador Program. Trina's been involved in it as well, as long as I have. So there are a lot of people who will help us out. If you can't get in touch with me, and if I don't know, usually these are the people I go to, Trina or Chasta, who is also a moderator, or Kathleen, people like that. We work together.
My
Right, Trina?
doors are always open, although I'm fully employed. Just hit me up on Facebook. If those of you are not connected through Facebook, my email address is the number one, but not the same, @gmail.com.
Hi, Trina. I have a question to ask you when you're done with this.
Go ahead.
I was going to ask you, how do you work with the fatigue and?
I don't have a choice. My sarcoidosis is sporadic, and what I mean by that is like I have really active episodes. That's the best I can explain it to you, where it's chronic severe, and I'm put on doctor's choice, which is the prednisone, which works best for me. And then I have my quiet storms, where I see the inflammation. For example, I just recently went to a dermatologist. He did a biopsy. I'm gonna find out I have inflammation on the back of my scalp. Well, they can't really say it's granulomas, although it looked like that, which is the sarcoidosis. All they can say is inflammation. So I got to start having injections, steroid injections in the back of my head. So when I say sporadic, that's what I mean. Like, I'll see granulomas growing on my eyelids, but it's not to the point where I need to be put back on medication. We're just watching it. And pretty much that's it. So I really, as far as the standpoint for Social Security disability, I would get denied because it haven't gotten to that point. Although I have lung involvement and I do have scarring of the right upper lobe, it has not conditioned me to the point where I hate to say that my health has declined to the point where I'm unable to work. Does that make sense? Listen, I'm 20 years in state government, actually 21. My goal is to retire and hopefully I have the energy and my body is designed where I can go into working on a cruise ship so I can see the world. Who knows? But that's my story. I have sporadic sarcoidosis. Doesn't mean that I don't have active activity. It just means that when it comes on full set, I'm in trouble. Prime example, me waking up, I think it was a Memorial Day weekend. I woke up Memorial Day, I think it was 2014, so accelerated heart rate. I laid there, I mean, literally, I woke up and my heart was racing so bad, it was pumping out of my pajama top. I laid there for a few minutes, I prayed about it, I got up, because at that time, my oldest was living with me. And I said, well, Lord, let me just make it to the grocery store and get some more food in this house, just in case I'm kept. And I did that, came back, I texted him, I said, listen, come up out of the basement, throw on some clothes, don't ask no questions. By the time I got to ER, they got me into the back of the ER, not even within 5 minutes, they put me up to all these machines, I started declining. My heart rate started dropping severely low, under 48 beats. per minute. Nothing but the glory of God for those of you who believe. If not, that's fine too. But this is just my testimony to you all that time is of the essence and you have to act accordingly. When it comes to your health, make sure you advocate, make sure you clarify whatever is being communicated back with you, your specialist or whoever is there to help and serve you. Do not shy up, do not be bashful. Come to an understanding what your body can and cannot do. Once you come to that understanding of what your body can and cannot do, you're being real with yourself and you're being real with your primary care or your specialist team.
Thank you, Trina, so much.
You're welcome.
So, yeah, so, I mean, like I said, we've all dealt with ups and downs, and that's why we do this. Because, like I said, when I first started, there was 4 people at FSR, and I could never get in touch with any of them. So I'm like, I got to open up this organization because nobody should go through what I went through. I was misdiagnosed. I told you a bunch of you. And I don't want anybody ever to get misdiagnosed the way I did. And that's one of the main reasons why we started this. And we also try to advocate that you are your own best advocate. You really are. You're the one who knows how your body feels. And you, even if a doctor says, well, I always say, let me look at the drug before you decide what we're gonna do. And then like before we decide, it should be a discussion that both of you have. Because a lot of these drugs do have really bad side effects, and you have to. It's your body, so you have to weigh the good with the bad. Personally, I'm not allowed to have prednisone ever again because of what happened with the diabetes. So I can't have prednisone. So that's one of the drugs that everybody gives you. So I'm not allowed. So I have to try other things. But
Frank, Frank, can I ask you a question?
Sure.
And this goes for anybody on the panel today. Did you find being on prednisone for long duration messes with your teeth? Anybody having dental issues?
Oh yeah, I've lost two of my teeth already broken. Kevin too?
Kevin? Yeah.
I have two teeth that broke just about 7 months ago.
Anybody else experience grinding when you're on prednisone in your sleep? Are you grinding your teeth?
I was. I got a mouth bite to prevent that, but that's almost as bad as grinding. Sorry. Saves your teeth, but your pillowcases have to be washed more frequently.
Sorry, go ahead. Kevin.
I mean, there's so many different I really didn't. I mean, I've heard about the prednisone and diabetes thing, but until, like I said, I was always in the 80s, 90s, always. And then I got my blood test on New Year's Eve of last year. And I got the results on January 4th. And the results I got were, the doctor called me, go to the hospital. Your blood sugar is 610. and then when I got to the hospital, that was only 4 days. Yeah, I got to there on the 4th. It was 890. They were like, I was in a trauma room with 12 doctors and nurses, and just 12 people working on both of my arms trying to find IVs. I mean, I was like, what the heck?
And this is why it's important that when you're on medications, that you stay on top of things yourself. Don't just rely on your specialist to know when to draw those labs. If they have you on medication for a certain period of time, you need to ask them, is there a lab? Do I need to take some lab? I think I'm overdue. Don't be afraid. And Frank, I get it, because with the prednisone, you're right. I'm borderline diabetic because of the long duration use of being on prednisone. It's a monster. It's a monster.
And that Eric, also, prednisone does make you fatigued. As much as it brings you up on highs, you crash. And that's what a lot of times your fatigue is going to be.
Yeah, I've experienced that. You know, I work full time. I lost my job during COVID last year, started a new job that requires a lot of energy and a lot of focus, and I struggle with both. And so I find myself working at odd times of the day just so I can get some work done. Whenever I have the energy, that's when I try to spend it on working. So yeah, and I have young kids at home too. My youngest is 10 years old. So it's been an adjustment. You know, it doesn't feel like it's that many years ago. I had a regular job. I was a volunteer firefighter. I had a side business, and as well as small kids. I just, you know, had a ton going on. I was going from 6 o'clock in the morning to 10 o'clock at night, and now I just it's tough to get out of bed.
The other thing, like I was talking earlier, I don't know if you were here when I was talking about it, is you may want to reach out to a counselor as well, because you know, like I talk about it all the time. Trina's heard me talk about it all the time. Just having all that stuff on your head wears you out too. You know, knowing that this prednisone's messing with your body, and I mean, just talking it out with somebody really helped me a lot. So much. I mean, like I said, my counselor saved my life, but not just physically, mental aspects of this disease. You really gotta, you gotta work on that. My sarcoidosis doctor, I mean, he is a doctor. He told me this disease is going to be 90% mental, 10% physical. He goes, even though we all feel it, we all feel the pain and all that, but the mental part of it really is what's going to knock you down. If you start to, you know, when you're fighting these,
especially being on prednisone.
Yeah, I mean, well, prednisone, like I said, you'll be raging at 1 minute, and then the next minute you're like, and just like total stop, slap in the face. And like, I was a runner before sarcoidosis. I mean, I got a college scholarship, full scholarship for running, and to go from that to, I mean, this is how I found out. I went out of my house, was going on my normal 5-mile run. I got a quarter mile into my run, and I stopped and had to call my girlfriend at the time, pick me up. I can't even make it back. And that messes with your head. Like you said, Eric, you were a fireman. You know, I always call this my new normal. And the reason I do that is I basically want to tell people that it is, you don't have to accept it, but what you should accept is the things that you know you can do, and go with that. At some point in time, you're going to have to stop thinking about all those things you did, because it's just not realistic anymore. You know it. I know it. So you have
that's
to think
what I'm going through right now.
And take every little thing. Like, I walk around the block here now. You know, I wasn't able to do that a couple of months ago. So that's a, you know, hey, you know, it's a step forward. That's the way, you know.
It's always good though to have somebody support you, Eric.
Oh yeah.
And be positive. Look for the people that are positive around you and are going to encourage you to try to get, you know, to another level, right, Frank?
Mm-hmm. Piggybacking off of what Frank was just saying, this is Trina speaking, Eric. Making those adjustments in your life, your mindset, fostering resilience, being, like I said earlier, being real with yourself. You're totally real with yourself, then you're opening yourself for other opportunities and making those small adjustments. Okay, so today I don't feel well. Fine, I'm going to take my time. I might have to take an extra 5 minutes.
You muted yourself, Trina.
Trina, you're on mute.
Those adjustments and staying true to yourself, you're going to accomplish more than you can ever expect.
Yeah. I mean, I always say that I'm actually a better person since I got sarcoidosis. I never saw myself running a nonprofit organization, actually two, never mind one. I never thought I would be doing that when at this age. And the people that I've met are closer friends than my regular friends are now. So, you know, you really have to set your mind up to, like you said, be true to yourself and find the things that you can do that you like. One of the things talking about brain fog. See, here's one of them. Is doing crossword puzzles, doing word searches. They really help your brain. Yeah, I actually, I had a psychiatrist actually go, he's like, do these, and it does it. My memory has gotten much better since I've done these things, because it's really exercise for the brain. That's what that is. So do things that will, like, if I find myself,
exercising.
I start doing Google searches on things, just to keep my brain going. But the thing is, you got to learn to shut it off too.
What type of stuff do you have, Eric?
It's pulmonary, I guess it would be called. I'm still kind of new to it, even though I've had it for a year and a half. I didn't get a lot of great information up front or treatment, so to speak. And I'm finally started about a month ago. I decided that, it started getting worse, my fatigue, and so I started doing some research. But it basically is in my lungs at this point. It's only in my lungs. It was found when I was having a spinal X-ray because I was having some back pain, and one of the things I'm trying to do now is figure out what's related and what's not, because I had a number of health issues that all came about at the same time, including the back pain, which seems to be more inflammation related than mechanical back pain because it goes away after I get up for a while.
I actually had it.
You might have some. Oh, I'm sorry, Frank.
That's okay. I had it in my spinal cord also. They actually had to do a spinal tap. Don't recommend it. Yeah, and I know what you mean about the back pain. It's kind of like it does go away at times, but then there's other times where it's really bad. You can't move. But they also consider spinal sarcoidosis is still considered neurosarc because it's fine. Right. So, like I tell people I have neurosarcoidosis, but I don't have any lesions in my brain. All my problems are through my spinal fluid and spinal tap.
Yeah, the sarcoid is in your fluid, right?
Yeah.
Now I have a question, Eric. Have you had a good spine MRI, CT scan?
No. And I think there's some things missing in the doctors I have seen. I did get, had my eyes checked, liver, heart, and those things, but nobody for GI tract or spinal.
Yeah, well, you have to really advocate for yourself and go get an MRI of your brain, your spine.
One thing I would say, Eric, when I know I gave you my email, I'll send you. I have this what to ask a doctor for beginners, for beginning patients. So you can go there and you get a kind of a list of the questions you should be asking, because that's the one thing I hate not knowing. That's my biggest thing. I hate not knowing what's going on. So I decided I'm going to write this list up, and and you don't have to ask all these questions, but these are just like really easy questions. But when you're in with the doctor, a lot of times you're like, you forget.
Yeah.
So I have this list that I could give you, and you could say, all right, out of these questions, I'll ask this and this one. It just gives you a little kind of a heads up. And you could also back when you see the doctor, after you see the doctor, get in touch with Trina or myself, and we can tell you if he said something and we're like, really? We can tell you. Okay, Trina.
Eric, you mentioned inflammation in your back. One of the things that concern me, sometimes things get passed off and brushed away.
Yes.
Have that conversation to be resurfaced when you go back to see your pulmonologist, and ask them to refer you to an orthopedic back specialist. Because you go to an orthopedic doesn't necessarily mean that orthopedic specializes in back pain or back injuries. So be very specific. And then when you get into that orthopedic specialist for back, ask them, why is it that you're having inflammation, and what is the next step course of treatment? So you're trying to pinpoint exactly why, how, and what do we do next?
Yeah, FSR has a really good, and I'm going to give you a link to their page too. They break down sarcoidosis to every part of your body and what you should look for. And so I'll send you that too.
What's that, Frank? What is it?
It's FSR has it. You have to you actually have to make well, you have to sign in. You have to make it, username and password, sign in. But in FSR, it's stopsarcoidosis.org. And I'll send you the links to it. It really breaks to every part of your body. It's so cool. I mean, it's things that I would have loved to have way back when, because I mean, maybe I wouldn't have had to worry about being misdiagnosed for so long.
Same here, Frank. I feel your pain. And this is for the whole platform this evening. I'm not sure if you're aware, but each specialty specializes in something. Meaning like the example that I've just given Eric, even though you go to an orthopedic specialist, don't necessarily mean that he specializes in back. He may just specialize in joints, preferably hand, knee, leg, or something up to that sort. But make sure you ask your specialist before going to booking those appointments. Ask the medical office, does this doctor specialize in X, Y, and Z? And they normally will point you into the right direction.
And
because you're going in to see a specialist, I mean, sometimes you don't really want to waste your time or your resources. You want to make sure that you're getting the proper care.
Yeah. He said he found the pulmonary sarcoidosis doctor, right, Eric?
Yeah.
Perfect.
Okay. So, you can bounce off a lot on him, but some of them just know pulmonary, and that's all they know. So yeah, but
Frank, listen though. I want to tell you before Eric gets off, and I went in and they told me I had pulmonary. I told them I had back pain. They wouldn't listen to me. They kept on telling me I had anxiety. It was all in my head. I was being a hypochondriac. After I was told I had pulmonary, I ended up having a brain bleed, Eric, after that. And that's when they found out that I had neuro, and it was in my spine and in my head. So you really, the pulmonary doctor was the one that found it, because he did a spinal tap. He called neuro down to do a spinal tap. I think that's what happened. It's kind of groggy to me because I had a brain bleed and everything, but.
And always get copies of the patient's notes when you leave your physician's office. Start your own paper trail. Go back when we have some downtime and just kind of review. If it's something that you don't understand, we're here to help you. Meanwhile, you can always Google that medical word and try to get a breakdown for yourself. But again, this platform, we're here to help each other and increase the awareness and and educate one another.
Yep.
Well, thanks, Trina.
And, you know, like I said, we've been through a lot. We don't know everything, but if we don't, one of the things, if we don't know, we try to find it out for you. You know.
Invest into a good medical dictionary if you can find one.
Yeah.
I have one whole cabinet that is just my medical records, because now I have it basically in every major organ in my body, and I see 12 different doctors now. One of the things I'm going to tell you is that find one doctor that you really like to be the point person, because you're not going to be able to keep all 12 on the same page. It's just impossible. You need a doctor, and it should be a pulmonary sarcoidosis. Really should.
And your primary too is important.
Yeah, and your primary issue as well.
Develop a rapport. Yep, develop a rapport.
I really highly recommend that, bouncing off ideas through him, and and that's the way you find out how good he is. Also, he or she is. You really.
Now, I want to go into just a little bit, because I know our time is short. We're about to wrap up, but I just want to go into a little bit about the physical thing. We're having sarcoidosis. I know some of y'all, like you said, Frank, earlier on, you was a runner, and some other people. I think that guy we just seen on Andrea's page, the fitness guy. I myself had just recently over the weekend, yesterday, I had went and bought a darts board and cornhole. If I can't get out and do, you know what I'm saying, something strenuous, I have something I can do. I'm moving. I'm getting that blood circulating within my body. So the only thing that's is me trying to figure out how to put up a darts board. And I guess I'll YouTube that. But just the little things, just self-enjoyment, your self-worth, spending time and your resources on you does a lot mentally as well. If you're always just paying out bills and you don't see any into it, at least one pay period out of the month, or those who's getting Social Security, one, maybe $40, $30 if you can afford it, set it aside and let it grow. And go for what, if you want to do something for you, embrace you. If that's how you have to do it, save your pennies, open the piggy bank and spend on something on you. You deserve it. Don't feel guilty.
Yeah, and also don't feel guilty if you are tired and you can't move. But I always say there's a difference between giving yourself time and then feeling bad for yourself. There's that line. If you're giving yourself time, a day, 2 days, okay, I need it. Even a week because you're really that bad, it's okay. But when you're spending every day for a month, you really have to reevaluate where you're at mentally, because
and what helps with the mental too, Frank, is drinking water. People always be like, I don't like water. I know I wanted them, but I'm drinking it now because I'm really like thirsty. I'm tired of drinking coffee. But drinking water helps with your mental state. It helps even with the body. Water is healing. So if you sip on a glass of water when you're going through that depression, just come up out of it by reminding yourself it's going to be okay, one step at a time. Do some breathing exercises to go along with it. You have to close your eyes and shut out the world. Find a room or a closet. Do that. Meditation will help you to come back to reality. And just deal with things as they come. You don't have to deal with everything on one platform at one time, but do what you can. Okay, well, the kids need new shoes, not a problem. We'll figure this out. We'll get it done. We cannot buy both of them up here at the same time, but we're gonna get one of them today or tomorrow. Work it out. Don't crowd your thoughts, because when you crowd your thoughts, it becomes cumbersome. That makes sense? So you kind of want to clear the path and just figure things out as they come. You don't have to figure it all out, but work on how your goal on how you want this objective to the end goal. That makes sense? Just
Yeah.
trying to figure out how I'm gonna start and where I want to be. The middle, it'll all work itself out.
Yeah. I always say this disease has made me more flexible than I ever have been. I used to plan every day. Now I plan on, all right, when I wake up, how am I going to feel today? And this I know what I'm going to do today instead of having it all written down anymore. It's, it is what it is.
Well, it also, all those things are wonderful. And, taking care of everything that she said is so true. That's so important. It's like the number one thing. But what about, how do I explain it? Like, remember when you sent me to Dr. Judson,
Yeah.
FR? He's a specialist. It's like right after I went to go see this specialist that was so well known, it like opened up the door to the other doctors. It's like, oh, okay, she really does have sarcoid. Like, we're all going to get together. I don't know. Or I don't know if it's just my imagination.
But that's why
he needs to have
offer these things. That's why I offer those things of, of paper, of what to expect when you go to ask questions. This way they take you seriously. It's not, a lot of the doctors will say, all right, just do this, this, and this. Well, you go there and say, wait a minute, this is not what I read or I've talked to people about. Then they know that you really care about what you do.
Well, like Frank, when I was getting rid of all my old doctors, my thyroid doctors, because I have a problem with my thyroid too. And the nodules are in my thyroid. Well, my old doctor said, well, I mean, it was just really, a rude comment because he was retiring anyway, so he didn't care. But he said to me, they just put sarcoid as a label because they don't know what somebody has. A doctor said that to me, and it was like, I was so upset about it. I thought it through, but then I'm like, oh my God, thank God I got to see these new specialists that are so positive and there with me. It puts so much stress off of me. That's what I'm saying. These old doctors, that didn't know anything or what they did was just ridiculous for me. And it might be for him, the next person, the next person, the next person. Ridiculous that they have to all go through that. It seems like everybody that has sarcoid goes through this, that they have these doctors that, can't find their sarcoid. They have all these problems.
Wendy.
That's from
Wendy.
Not knowing.
Yeah, Trina.
Okay, I want to say this, and I had the best of both worlds. First and foremost, specialists are people too.
Yeah.
They're only practicing medicine. Yes, granted, we expect them to know it all. Unfortunately, they don't. As a patient, rather you have sarcoidosis, cancer, whatever else you have to become informed at some point and take some responsibility. I'm not trying to be harsh, I'm just trying to be real. With that being said, the doctors I came across here in Georgia has been very helpful. My first journey with my primary care, he sent me to every specialist there was until he said, I'm sending you to a pulmonologist. I don't know. I can't figure this out. So, not to be an ass, but let's put some truth on that. Every doctor that you go into may not know, may not have all the answers. And this is when teamwork works best.
One of my best doctors didn't know a thing about sarcoidosis, but you know what? He took the time to look it up and learn about it, and that to me was the best thing any doctor could do.
And they really don't go when they go do their residency. They may do a scenario and that's it. They may not never see a sarcoidosis patient in their office or in an ER when they have to do their residency. So
okay,
literally
the team that I have now is awesome. I have like, I don't know, I can't answer anything better right now. They're,
Great.
I don't even know who
Awesome.
caller one is, but I'm just saying, I just know that they're trying to help me. They get on these group things sometimes. They're so involved with me. It's just been a miracle. I just feel really lucky, but Frank led me to all of this stuff, and I owe him my life.
The way you go repay it is pay it forward, right, Trina?
That part. Yes, that part. And again, fostering new growth, keeping a positive mindset will keep your mental intact. Good night, y'all.
Good night.
Good night.
Trina,
Eric, like I said, contact
good
me.
night.
Okay.
I'll do that. Thanks.
All right.
Bye, Frank.